Hello, everyone. Thank you so much for joining us today. Welcome to the 2021 American Diabetes Association Living with Diabetes Ask the Expert series. Today's topic is lifestyle choices to protect your heart. My name is Shamira Robinson, registered dietitian nutritionist and certified diabetes care and education specialist, and of course, your host for today's program. Our Ask the Expert series is all about answering questions from our listeners, so start getting those questions ready. For those of you on the phone, press star 3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. And if you're online, no worries. All you have to do is type your name and question in the field below the streaming player. Once you press that submit question button, it will come directly to us. Stay with us through the hour, and you will learn useful tips to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in our 5-question survey at the end of the event. All right, now let's talk a little bit about why we're here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched Know Diabetes by Heart. With support from founding sponsors, the Boehringer Ingelheim and Eli Lilly and Company Diabetes Alliance, and Novo Nordisk, as well as national sponsors Sanofi, AstraZeneca, and Bayer. The Know Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce their risk of cardiovascular disease. As a part of the initiative, the ADA is holding this free educational Q&A once a month, and will cover information and tips to help you take charge of your health. The health and safety of all those we serve at the American Diabetes Association is always our top priority. With that, COVID-19 continues to be a serious public health threat. In general, people with diabetes face greater risk of complications when dealing with viral infections, and that is true with COVID-19 as well. Current CDC recommendations to protect yourself state that you should wash your hands often. If soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Avoid touching your face. Practice safe social distancing and put distance between yourself and other people. Cover your mouth and nose with a mask or cloth face covering when around others. The ADA encourages people with diabetes to follow the guidance of the CDC and to contact your medical provider if you suspect that you are showing symptoms or have been exposed to COVID-19. For our most up-to-date information, please visit our website at diabetes.org/coronavirus, or you can always give us a call at 1-800-DIABETES. That is 1-800-342-2383. Like many of you, we are still practicing social distancing, so we are proud to present this month's Q&A from our own homes. So from my home to your home, I want to introduce our guest for today. Welcome, Melissa Young. Dr. Young is a clinical pharmacy specialist with over 20 years of experience in diabetes education and management. She is a certified diabetes care and education specialist and has earned a board certification in advanced diabetes management. She specializes in the treatment of adults with complex diabetes and metabolic disorders while providing chronic disease management via telehealth services for veterans. Melissa, welcome. We are so happy and just thrilled to have you. Why don't you start us off by just telling us a little bit about yourself?
Well, thank you. And yes, my name is Melissa, and I work with veterans across the Rocky Mountain region, currently in Idaho, Colorado, and Montana. And I work with veterans to help them better manage their diabetes through my telehealth clinics. Right now, I'm VA-based in the Salt Lake City area. I also enjoy volunteering my time to work with organizations such as the American Diabetes Association for Diabetes Care and Education Specialists to provide educational presentations and to advocate for individuals living with diabetes. I'm very happy to be here and excited to address your questions today.
Thank you for that, Dr. Young. And as we are waiting for our callers and online listeners to chime in, I'm just going to go ahead and toss out the first question here. So I know we talk a lot about the link between heart disease and diabetes, but some of our listeners may not be familiar with that link. So could you take a moment and just briefly discuss what's the connection between heart disease and diabetes?
I would be happy to. The first take-home message is that diabetes, it really affects the entire body, not just the blood sugar. And this has become more evident over the past 20 years as research has linked even early pre-diabetes to the development of high-risk cardiovascular disease or heart disease. And the cardiovascular disease is where the heart and blood vessels have become damaged. And this is the #1 cause of death in people living with diabetes. This results in 2/3 of deaths in people with type 2 diabetes. On top of that, people with diabetes are twice as likely to have heart disease or a stroke than people without diabetes. So very high risk. Researchers have studied the possible factors linking the cardiovascular disease and diabetes. There's a lot that's still unknown, but they've linked inflammation from obesity, high blood pressure, high cholesterol as common traits in people living with diabetes, especially type 2 diabetes. All of these are known risk factors for cardiovascular disease. However, there is some good news in all that I just said. With proper exercise, nutrition, diabetes management, you can reduce your risk of developing cardiovascular disease or of it progressing and the complications that come with it.
Thank you so much for that, Dr. Young. If you are just joining us, welcome to today's Ask the Experts Q&A. We are going to discuss lifestyle choices to protect your heart. As a reminder, if you are joining us on the phone and you'd like to ask a question, press *3 on your keypad and an operator will collect that question so that you may have the opportunity to ask it live. And if you are online, no worries, just type your name and question into the fields below the streaming player and press that submit question button so that we can answer that question as well. All right, now let's get to our first caller. I am going to Jackie in Virginia Beach. Jackie, you are live and you may ask your question.
Hello, I'm a type 1 diabetic for over 40 years. I have a A1C of 5.7 to 6. My endocrinologist tells me I don't need to see a heart specialist. I feel that I should get some sort of a base. Should I go once every 5 years or just listen to him and not go at all?
Hi, Jackie. Well, that's an excellent question, and it sounds like you are following up certainly with your endocrinologist, and I assume that they are assessing your cardiovascular risk, your cholesterol levels, and that's something that's very important when we are wondering what is our risk of heart disease, that we are having our cholesterol levels checked at least annually, that our blood pressure is being monitored. That's also important. And that, our weight is where it should be. And so that would depend on whether, those things are also being assessed. And also this trust relationship that you do have with your endocrinologist. Typically, they'll refer you to a cardiologist if you're at a higher risk. It sounds like you have really well managed your type 1 diabetes. So, I applaud you for that. Whether you should go or not, I haven't specifically looked at all of the details. However, I think it would depend on whether all of these other these little details as far as the cholesterol and the blood pressure and things are being monitored. I would ask your endocrinologist, what is my risk for heart disease? What is my 10-year risk for heart disease? Because there are calculators now to assess that risk and see if you can have that conversation with your endocrinologist. That's I think is would be a great first step for you.
I love that. And now we are going to our next question. Luella, and who is also in Virginia. You are live and you may ask your question.
Yes, I have been having some heart palpitations, some small pain in the chest, and I would like to know, due to the fact that I am diabetic and my A1C is not as controlled as the first participant, I would like to know what is my next step, and could it be connected with a heart issue?
Hi, Luella. Thanks so much for your question. When we think of heart palpitations, that can be certainly your heart telling you, hey, there's a problem, and so that can be a signal of a heart issue, and it can be whether your A1C is under control or whether it's at goal or not at goal, and so your next step would be to have that assessed, and I would recommend that you get in touch with your provider and get an appointment. And if you're experiencing chest pain and palpitations, that can be actually more of an urgent issue. And I would recommend that you seek care, more an emergent care if you're having heart palpitations.
All right, and I think that's a good segue. We have an online question from Todd, who is in Michigan, and Todd wants to know, what symptoms should I look for in regards to heart problems? So what would you say, Dr. Young, some go-to things you can keep in mind if you're concerned about your heart health?
Excellent question. So as far as heart problems, if you're having any type of persistent pain or pressure in your chest, these are signs, these are emergency warning signs. If you are having palpitations, funny heartbeats, these are emergent warning signs. Difficulty breathing, if you are unable to exercise as much as you used to be able to, that's exercise intolerance, those types of things, you do need to be assessed. And those can all be emergent conditions. So in that case, you need to be seen, emergently. I would go seek care for those types of things. Also swelling in the legs, in the lower legs, any type of that. Water retention can also be a sign of heart problems. Mm-hmm.
All right. And just a reminder to everyone who's listening in, at the conclusion of our Q&A segment, you are welcome to stay on the phone or online to complete a short 5-question survey. Your feedback is so very important to us and will help us with future planning. You have been asking such great questions so far, so let's hop right back into it. Okay, we are going to Pat in South Carolina. Pat, you are live and you may ask your question.
Hi, yes. I have I'm type 2 diabetic, and I also have IBS-D. So some of those symptoms that you described that pertains to the heart problem, I experienced that. And my question really is, how do I tell the difference if something, you know what I'm saying, if it's just that kind of stuff or if it's something wrong with my heart?
Right. So, and that's an excellent question. And the best way to do that would be to follow up with your provider, because what needs to happen is that you need to be able to have yourself assessed, so that way your provider and you can work out when to call your provider. It's like a sick day plan almost, but it's for a different chronic issue. And it is that way with anything. Some people have asthma, so they have like a plan for when to call their provider for asthma. And it's the same type of thing. So you should ask your providers, when do I call you? With what symptoms do I call? With what symptoms do I need to go to the emergency room? And work out a plan with them. What symptoms can I expect to be happening, on a normal day with this condition? And that's how you can, help to kind of tease out the differences.
I love that, Dr. Young, and I think that's so important because a lot of times, we might wait until we're experiencing some symptoms or something seems a little off, but knowing that we can go in, have that conversation with our healthcare team and say, hey, just so I know, what are some symptoms that, I should be thinking about? What are some things, if I start feeling this way, that I should contact you immediately? What are all of those things that I need to keep in mind just to make sure that I am getting the assistance I need whenever I might need it? Okay,
Exactly.
we are going we are going to Norman in Royal Oak, Michigan. Norman, you are live and you may ask your question.
Good afternoon. Thank you for taking my call. I've always been encouraged by the program. My question has to do with the amount of activity that we can pursue and how important that is to ourselves. At the present time, I'm 75 years old. I take my dog to the dog park several days a week, so much so I can walk around myself. But I'm always concerned that I don't overdo, and yet it's very vital that I keep active. The activity has a definite role in my life. Can you give me some advice about how I should pursue being more active, or am I stretching it too much?
Hi, Norman. Thanks so much for your question. And I commend you for being active and thinking about this, because activity is so important. And it's not only for, the blood sugar lowering, but it is for your heart health, and it also can help your cholesterol and the weight management and the blood pressure. And there is a recommendation from the American Diabetes Association that most adults with type 1 and type 2 diabetes should engage in 150 minutes or more of a moderate to a vigorous intensity aerobic activity per week. So that's spread over at least 3 days per week. And that's, really with no more than 2 consecutive days without activity. Now, that also needs to be individualized to where you start out with, to what else you have going on, to things like if you have neuropathy, to other, things. For instance, if you have complications from the diabetes, like eye disease and so forth. But that is just a baseline recommendation. Also, so walking is great. Walking is great. And, if you could increase that, you could increase your walking time. Going to the dog park is a good thing. And make sure that, your footwear is good and is appropriate to be walking that far. And then also resistance training is also recommended. Some type of resistance exercise in 2 to 3 sessions per week is recommended as well, and to be beneficial.
Great. And that piece you said about making sure that it's individualized, I think that is so key, Dr. Young, just because we're all at different starting places, right? And so for some of us, 150 minutes might sound like a lot. And, there's no pressure to push yourself or to overexert yourself, but just figure out where you're starting from. For some of us, getting up every hour or so and just taking a walk around the house, or, just standing and sitting a few times gives us a little bit more activity than what we were getting. So really look and see, how can I add a little bit more movement into my day and start there? And of course, our goal is to work towards that 150 minutes, but we all have to start somewhere.
Right.
And I think this is a great segue to one of our online questions. And let me find it. Yes, Donna, she was asking a question. So she says that she has type 2 diabetes, but she also has some problems with mobility and can't stand for long periods of time. And she's looking to be more active, and she wants to know if you have any resources or recommendations to really be a little more active when you're having limited mobility.
Mm-hmm. So there are some excellent exercises and ways to be active if you have limited mobility. There are chair exercises that you can do, simply sitting in a chair. And since you do have access to the internet, you can simply, go on and do a web search for chair exercises, and they can really help strengthen your muscles. Any muscle movement that you do is helpful. Any consistency that you have is helpful. Just like we were talking about, it's just starting somewhere. And we don't want you to, push it too hard. We just want you to start low, go slow, be consistent, work your way up. And so definitely that way. Also, working with your provider, sometimes in a pool, that can help in people with limited mobility. If you can work with an exercise therapist that way. But those types of things can be very helpful with limited mobility. But chair exercises is an easy way to start, and you can do that right at home, and it doesn't take any equipment. Just a chair and you, maybe a couple of canvas to hold in your hands. Hand vegetables, maybe. That's all.
Yeah, and so this sounds like there are definitely options, and I think a great point, figuring out, how you can loop either an exercise specialist or physical therapist, something into your care team to make sure that they're really helping to craft exercise plan, a movement plan, activity plan that fits your needs, because we want to make sure you're active, but we also want to make sure you're safe. That is equally as important, if not more important.
Exactly.
Okay. We are going to Doretha in Washington, D.C. You are live, and you may ask your question.
Hi, I'm Doretha, and I was asking, it may be a question may have to be talked about offline, but I have been on various diabetic medications, and here recently my insurance company is not on their tier any longer, and so they recommending that I go back to some of the medications that I've been found to be allergic to. I've had some complications with it and stuff, but unfortunately the doctor that I had during that term is now retired, so I have a new doctor, and it's almost like I'm up against a wall trying to get prior approval or authorization to be able to continue the medication I'm on now, which is Unglyzer. I've tried the other meds like glutathione, metformin, and Juvenile, I think that's the name of it. And I've had serious issues with that, taking that particular medication. So it took my doctor a while. It's spelled Gentadueto. I've tried that medication as well. But it seems like all the medications have not been very well for me. So he ended up with this medication. It's an older medication, but it's called Unglyzer. And now it's off the tier that my insurance company covered. So my new doctor's in the process trying to get prior authorization. This is her second attempt. And so they want me to go try, I guess the generic stuff that they have brought out recently to do that. And I need an advocate. I'm just going to be honest because I have heart issues now. In 2019, my heart rhythm, I guess, slowed, unbeknownst to me. I was always told I had a murmur, but no one ever told me that I had a problem with my heart rhythm. But I was also put on some medication by a doctor, which may have slowed it down. It was mirtazapine and Lexapro. And I'm learning now that wasn't a good combination for them to have me on. But so now I have a pacemaker, and what I suffered with is something called sick sinus syndrome. I don't know if your heart rate's slow, and it caused me to collapse 3 times. Heart basically stopped. So I'm very reluctant one to try, you know, medicine just to save $1. And so I really need help, or maybe offline or whatever, if I can get an advocate or someone to help work with me concerning the situation that I've been facing.
Okay. Hi. All right. So it sounds, I mean, I can definitely empathize with the frustration. Being a pharmacist, I understand with the frustration with trying to obtain prescription medications and the prior authorization process and so forth. And especially if a medication is generic and so forth, or there's generic alternatives available, and then trying to obtain a brand name can be very difficult. And as far as advocacy, as I wonder if the American Diabetes Association has advocacy for things like this, and also some of the manufacturers do have patient assistance programs. I'm not sure if this medication, though this is an older medication, so this may well not be covered under that. But it would seem that if there were prior adverse reactions documented to the other, you know, medications, then perhaps your provider could be able to get the prior authorization through. Sometimes it takes several times to get a prior authorization through. It just has to go to the right person. You know, has to go to a secondary reviewer at times. And I would say hang in there with that, and keep moving forward.
Sure.
Yes.
And I'll hop in here. So, Dorita, thank you so much for calling. And I think your concerns are so valid. And if you do feel like you need an advocate to help guide you in that, you can always reach out to our Center for Information, and they can assist you and help to point you in the right direction. And so that number to call is 1-800-DIABETES. Again, that is 1-800-342-2383. And you can let them know a little bit about what's going on and see how you might be able to get connected with someone who can help advocate for you in that sense. And I think since we're on the topic of medications, Dr. Young, can you tell us, like, what diabetes medications have been shown to be beneficial in protecting the heart?
Certainly. I love to talk about medications. So, right up my alley. So, as far as heart protection from diabetes medications, this really came about here in the past 15 years or so. And when new diabetes medications that came on the market first, they had to be, and this according to the FDA, they had to be proven that they would not cause heart problems, essentially, put people at increased risk for, you know, heart attacks and strokes and so forth. And then with these studies, what happened is we found that, wow, some of these medications actually reduce the risk of having heart attacks and strokes, and actually reduction in heart failure and so forth. And so there's a couple of classes of medications that are really standing out now. And one of these, and you will see, I'm sure, lots of commercials, the Sglt2 inhibitors. They're we call them the flozins. These are the empagliflozin or canagliflozin or dapagliflozin, and you may have known some of these Jardiance or you know, the Farxiga or the Invokana are some of the brand names, and those have been now studied in many people and shown that they can help reduce the risk of having these cardiovascular outcomes, for instance, the heart attack, and reduce the risk of a stroke in people with diabetes, and also the one of them there with heart failure too. So we're seeing these benefits, and so we get excited about this, right? Because we have one medication that we can use for multiple things, and there's another class of medications as well, and they're called the we call them the GLP-1 receptor agonists. And these are the once weekly, they are an injectable to where the other ones were a pill. And you will know these as Trulicity or Ozempic or Victoza. And these are also the same thing. They've been studied and been shown to reduce the risk of cardiovascular events, heart attack, stroke, cardiovascular death in adults with type 2 diabetes and established cardiovascular disease. And then one of them is in patients or in people without, they have high risk of cardiovascular disease. So this is quite exciting as well. And so, you know, these newer medications are coming out and we're able to add them on. Of course, they do come with some cost. And you know, we have metformin, which is still the number one first-line medication for people who have starting out with type 2 diabetes. And it does also have some cardiovascular reduction, risk reduction data as well. So you know, we do have some of the other medicines too that also help with that. But these are the main two, and then we have metformin and so forth. So I can go on about this. We won't get to other questions. I'll just stop there, and then we'll just go on to the next question.
Well, you heard her. She loves talking about medications. So if you have any confusion about maybe how some of your medications work or some of those combinations, feel free to call in by pressing star 3 on your keypad, and we will talk about it. But I think this is such a great segue. So now I'm going to go to Jerry in Florida. Jerry, you are live, and you may ask your question.
Yes, please. I was taking metformin, and then I understand that it had some cancer agents in it, and they had the recall. Is the recall over with?
Hi, Jerry. So the recall that you're speaking of with metformin, so what's happening with that is that they keep finding different lots of it, and you know, different, and so it's not completely over. No, I think, I mean, I don't know the exact status of it, but I keep seeing, you know, that there's different lots being recalled. So I don't believe so, but that doesn't mean that what you have is being recalled, like your specific lot that you're receiving. It just means that some of them have been recalled. And I'm not sure of the exact status on all of the metformin lots, but I know that it's been going on for quite some time, and it's been causing lots of frustration with people. I understand that. And it's just been wider and wider and wider. And what that contained was the nitrosamines or the NDMA, and that's the same thing that has been in other medications as well, like for the popular heartburn medication, you know, the generic Zantac and so forth too. And so it's just widened, and the FDA is finding different lots. So we're hoping it will be over soon, and we can get back to normal with metformin.
So there is someone who's used to taking metformin. How do they go about staying up to date and knowing, you know, when this might be over, or what's the best way for them to get that information?
That's an excellent question. They should be in contact with their pharmacy, because that is a patient, what we call a patient level recall, meaning the patient who's receiving the medication is supposed to be notified of that recall, and then any that needed to be discontinued. They can always go on the FDA website. However, that gets, you know, a little confusing because it just lists the lot numbers and so forth. So it's really best to keep in touch with the pharmacy that you work with to receive your medications from. They will be able to tell you if the metformin that you are receiving is, you know, recalled or not, and so forth. You should receive letters from them. You should receive phone calls if there's a chance that your lot that you're receiving is recalled. And what I've seen is just kind of spurts of this happening. It recalls, then it's kind of over for a bit, and then it recalls again. I do work in the federal government system, so it might be a little different on my end than out in the community, but it's the same type of recalls.
Okay, that is a helpful tip. So if you do have questions, you can always go to your local pharmacy and ask to make sure. But it sounds like if there isn't any concerns with your particular metformin, then it is okay and recommended for you to continue taking that as it's been prescribed by your healthcare team.
Yes.
All right. Well, let's roll to Carl in Brooklyn, New York. You are live and you may ask your question. Oh, I'm sorry about that. I got my lines mixed up. Betty in Washington, you are live and you may ask your question.
Yes, my question was as it relates to the COVID vaccine, and I was wondering about after they take the second dose, what effects might it have on your heart or other parts or whatever? Have they any information on that yet?
Hi, Betty. Thanks so much for the question. I know that there's so many questions about the vaccine, and there's a lot of concerns and so forth, and so after the second dose is the same in most cases as the first dose. So you're unless that should be the same, and in most cases. So as far as your heart, really it's just building an antibody response. So there's really the adverse effects have been more of the sore arm, the achy muscles, possibly just signs of inflammation is what they've been. Maybe a low-grade fever, just not feeling well, just feeling, just not well, and it usually lasts a day or two. And so really that's been, the main effects from the vaccine in and of itself. And that's with the first and the second dose. I know that there's been some discussion that the second dose can be, the adverse effects from it can be a little more severe than the first dose, but they're still expected to be about the same type of adverse effects.
Okay, well, now we will go to Carl in Brooklyn, New York. Carl, you are live and you may ask your question. Hi, Carl, do we have you on the line?
Yes. Hi, good afternoon. We'll call you back. Hello?
Yes,
Hello?
you are live.
Hi.
You may ask your question.
Yes. I just have a question, regarding the diabetes. I'm number 2, type 2 diabetic, my wife and I, and I'm having mixed information. There information saying that it's not reversible, you can't cure it, and I'm also getting information that it can be cured. My Brooklyn Bar president, Eric Adams, he had diabetes, and he said with his change of diet and lifestyle, he no longer has it, and he also encourages mothers. So I want to get the true, information. Is this something that can be cured or changed, reverse, where one would not need to take medication?
Hi, Carl. Thank you so much for that question. I think that what we need to talk about is a cure versus a remission. And really what we're talking about is a remission, meaning can you do things to get your diabetes so well managed that you no longer need the medications? Because that's really effectively, what you're asking. So it's not really so much worried about a cure, but just can you get it in remission? And certainly, changes in the nutrition, the activity, and, looking at your numbers and just managing your blood sugars and with medications and all of these things put together and working with your diabetes care team can make just a huge change in your diabetes. And we have seen, just like you mentioned, with someone who was able to come off of medications. But here's the important part. Even if someone would remain on some medications, but their diabetes is very well managed, that means they really reduce their risk of complications in the future. And I understand that, we don't, we want to simplify the number of medications that people take and the type and so forth. But we really want to just keep things under control, keep things well managed, and that can be done with what we're talking about with the lifestyle changes and the therapies and so forth. So yes, that can be done. That is different from a cure for diabetes. Okay. So, but definitely, remission and so forth. Yes.
Yeah.
And
I love that point. I love that point, Dr. Young. And there is a difference, because the way that I like to think about it is, essentially when we say we've cured something, it means, it's gone and we don't have to worry about it again, right? And so like you were saying, if you get to the point where you're managing your diabetes really well, you're thinking about what foods you're putting into your body, you're thinking about how much you're being active, you're thinking about your medications and taking those as they're prescribed, and now your diabetes management is in a really good place. And so sometimes in that mindset, if we get to a point where we say, it's cured, it's like, I don't have to worry about this or keeping up with any of these changes I've made because it's gone. But what will happen is if you start going back to some of those, old eating habits or those old inactivity habits or things like that, you can see those numbers start to creep back up on you. So instead of thinking about it in terms of, I am cured and I don't have to worry about this anymore, really striving for, okay, what can I do to make sure that I am living my healthiest life, that I am feeling good, and that I am managing this and staying within my target range to the best of my ability. And sometimes it's a bit easier to think about it that way. And and we need help with that because there are a lot of pieces to navigate. So we talked about the nutrition piece, we talked about physical activity, we talked about medications, and then support that would look like. And so I think that's also a great place to think about diabetes education. And so finding a diabetes education program in your area can really help to give you some more of that information, Carl, and really help to empower you on that journey. I know you mentioned just a mix of resources, and so that could help offer some clarity as well. And so if you are looking for a support program, I know a lot of them are virtual now, you can find one on our website at diabetes.org/experts. And that would be a great place to start and really think about. So with that, I will say that we have quite a few questions coming in related to metformin, Dr. Young. And so one person is asking, I'm just going to read them to you. One is asking if there are any heart protective benefits to metformin. And then we have another caller, an online listener, Sheila, who is asking if there is a best time of day to take her metformin.
Okay, so yes, there are some heart protective benefits from metformin, and so it was emerging evidence that came out. It was a very long-term study that shown that yes, there was heart protective benefits of metformin, and let's see here. As far as the best time of the day, that depends on the type of metformin that you have. So there are different formulations of metformin. There's a sustained action formulation, and then there's an immediate release formulation. So the thing you can take twice a day if it's an immediate release, and you just take it 2 two with breakfast, two with dinner. And it is best if you take it with your meal. It actually helps slow down the absorption of carbohydrates from your meals. That's one way that it works. And then the other way, of course, is that it helps to improve insulin sensitivity of the liver. And so that is one way to take it. But if you do have the sustained action version, the SA or ER, it depends on how it's prescribed by your provider. It could be still prescribed twice a day, or it could be prescribed for once a day. And in that case, it is typically prescribed with the evening meal if it's once a day. So it just depends on how it's prescribed for you.
All right. Well, now we are going to Autumn in Cleveland, Ohio. You are live and you may ask your question.
Hello. Thank you so much for taking my question. I hope I articulate it correctly. I'm on a drug called Sglt2, and it's my understanding from my endocrinologist and my primary care physician that actually the Sglt2 is what has caused my sugar problem, that it's a side effect from the Sglt2, to the point that they now classify me as having type 2 diabetes at 40 years old. And they know this because I was getting monthly blood work for having a potassium problem. And my blood sugars were between 80 and 92 every month until I started taking Sglt2. And then my sugars started to increase as soon as I started taking the Sglt2, about a month and a half after I started taking the drug. And they've decided that me staying on the Sglt2 outweighs the benefit of controlling what they say I now have diabetes. So my question is, I'm perplexed on how a medication can affect your sugars so much. So can you tell me how this Sglt2 medication works, if you're familiar with it, on how it can cause such a problem with sugar?
Sure. So this class of the way that those medications work, or I should say that just the overall class of those medications can make you more insulin resistant. So you're making, the insulin that you're making in your body just isn't working as well. Like your cells aren't listening to it. And so your blood sugar is going up because the cells the insulin's just not going into the cells. When we have sugar in our blood, insulin's a hormone. It comes from the pancreas, okay? And then the insulin goes to the cell. It's like a key to a lock, and it tells the cells to open up the door, let the sugar in. But the cells are like, I'm not listening. They're resistant to insulin. So the blood sugar's coming up. And there are certain classes of medications that will cause insulin resistance. And so then it does become a risk versus benefit. Are the benefits of this medication, do they outweigh the risks of this insulin resistance? So the way that it typically works then is that if you stay on this medication, then we manage the diabetes. We manage the blood sugars, right? And so you would have then a plan for blood sugar management. And so you would have plans for both, right? And so that's typically what would happen in this type of situation.
All righty. Thank you for that. Now we are going to, let's see, Jim in Pennsylvania. You are live and you may ask your question.
Yes, I don't know how to phrase this, but I am trying to get started on Freestyle Libre 2. That's the device that you put the little disc in your arm. I got the meter okay to start it, and I got one disc, and I went through 14 days of the program, and I went back to the pharmacist to get some more discs, and they said, oh, your insurance company won't pay for this. You haven't been approved. Well, I spent a day on the phone with my insurance company talking to everybody in Aetna that I know, trying to get this problem resolved, and I still have not. I've been a month and a half now without any discs because they claim that it requires a special letter from the doctor, which I asked for,
Mhm.
and I'm not sure. I'm not sure where I'm at on this.
Okay. Sure. I understand your frustration. Again, you know, as a pharmacist, I totally understand. And to get any type of this type of system, they will typically require at least a lot of the insurance companies will require extra paperwork. I would ask your physician if they've submitted the appropriate paperwork for you. I think that would be a great first step because that seems like that needs to happen first. Because until they have that, until the insurance company has that, to show medical necessity for that, because otherwise the insurance company, most will think you can just use a meter and test strips, right? I mean, that's the typical thought. And so the physician will need to show medical necessity, you know, through providing a form. So that would be the first recommended step, would be to reach out to your provider whom you've asked to write that letter.
Thank you. Now let's get to an online question from Jennifer Wilson. She is asking, is there really a heart prevention benefit to taking a low-dose 81 milligram aspirin? I have heard conflicting information.
Well, that's an excellent question, and I think that's because it has went, you know, back and forth. The recommendations have with aspirin over the years, and studies have shown that there are benefits in the right person. All of these things have to be individualized. Any medication, even a baby aspirin, has risk versus benefits, and if someone has an increased bleeding risk, then an aspirin is not going to benefit them. So that's the thing. Everything has to be individualized. But studies have shown that there are some heart protective benefits, but in the right person.
Okay. We are going live to Marie in Pennsylvania. You may ask your question.
Hi. I was asking about the metformin, the changes in the metformin. I haven't heard anything on it yet, but I'm wondering who would notify you if there's a problem with the metformin you're taking.
I'm glad you asked that again because I wanted to just make sure I'm clear with everything on this. So the pharmacy, whatever pharmacy fills your metformin, they would notify you if the lot of metformin that you received has been recalled. That's where you would receive notification from. And the recall actually states that you can, you know, continue the metformin that you're taking until you would receive replacement metformin. So that's the recall that had been received. And so if you would receive a letter like that from your pharmacy, then you would just follow the instructions. Otherwise, you could reach out to the pharmacy. The number would be on the label, on the prescription label, and ask them if you know there's an issue with the metformin that you receive from them. They will know. They track it lot by lot.
Okay. Looks like we have time for just a few more questions. I am going to Karen Moore in Maryland. You are live and you may ask your question.
Hi. I have diabetes too, and I've only had it, I guess, a year and a half or so. I'm not sure because of the pandemic. I've lost track. But anyway, I'm doing testing every other day, and my numbers are within range and pretty good. 80 to 130 is the range I have here. In the afternoon or after meals, even at night before a meal, even if I've gone a long time without food. But in the morning, my numbers are I get the red on my meter and they're high, but they're like 130 up to 154. Sometimes they are more within range. But to me, when I see that red, I think, oh no, this is alarming. But when I talk to my endocrinologist or my doctor, they just kind of move on to the next topic. So, and I've looked it up, and I'm confused about what can cause it, and if I should be alarmed, or when I should be concerned about this. The high numbers in the morning.
Mhm. Okay. Very good question. So, a couple of things about high numbers in the morning. First of all, just things about a high number. We always look at a trend or a pattern. So, one elevated reading is just one elevated reading. So, we want to look at the pattern because the blood sugar is like the blood pressure. It just goes up and down. Okay. Hormones affect it, food affects it, activity affects it. All these things affect it, up and down, up and down, up and down. But we look at the pattern, the trends. Now, in the mornings, so I'm assuming there's no food or drink overnight except for 8 hours, except for water. What can cause that? People, they go to bed and their blood sugar is 140, and then they wake up in the morning and it's 170, and they're like, what happened? Well, what happened is that their liver has been not behaving overnight, and it's been putting too much glucose into the bloodstream. That's typically what happens with that, because the liver is resistant to insulin. And I just had discussed how metformin is one medication that, well, it is the medication that can help with that. But the liver does do that. Now, also, a late meal can affect that, and too large of a meal later in the evening can also affect that. So there are different things that can affect that, and we really just, it's kind of like we play detectives. When you get that odd number, think about what happened the evening before. But if it is a trend that's occurring, that's, just document the trend and bring that up to your provider.
Okay, and I think this is such a great question, and I just want to go back and I know the listener mentioned some ranges. So, Dr. Young, my question to you, what is the recommended target range for blood glucose levels to reduce your risk of complications, including heart disease?
Yes, and thank you for that, because somehow I got caught up in the other thing. So the fasting blood glucose range, now this is a general range. People may have individualized ranges, but it's 80 to 130. That is a fasting. That's 8 hours with no food or drink except for water. So that's in the morning, 80 to 130. That's on a glucometer. That's a meter. That's not on a continuous glucose monitoring system. That's a different type of sample. And then within 2 hours after food, the range is less than 180. That's a target. As I said, these are standardized goals. If someone is elderly or has a lot of complications or so forth, they may have higher goals, and that's fine. And so they may have individualized goals. That's what we want, individualization. But those are standard goals, standard blood sugar goals, within a standard A1C goal of less than 7.
All right, I'm going to try to squeeze in one more. We have to make it quick, but I am going to Wendy in New York. Wendy, you are live, and you may ask your question. Hi, Wendy. Are you on the line?
Oh, yes. I'm from Long Island.
Hi, Wendy.
from Woodbury, New York. I wanted to find out. I have type 2 diabetes for many years now, and I had three cardiac stents put in my heart. I had I was having heartburn and gastrointestinal problems. I went to the gastroenterologist. They gave me a medication for the heartburn. I took it for a month, and it got better. After the month was up, it came right back again, and I went back to the doctor, and he said to me, "Well, let's do an upper endoscopy," which revealed a small floating hiatal hernia. The pain came back, and I said, this pain is not. It has to be something cardiac related. And it's a good thing that I didn't listen to the doctors. I went to the cardiologist, and I had a nuclear stress test. When I got to the treadmill part of the test, that took me immediately off the treadmill, and they sent me to the hospital because I found out that I had 100% blockage in my LAD and a 99% blockage in my right anterior coronary artery, and and because I have some kidney disease, they had to protect my kidneys with medication before I could have the catheterization done. So I had the catheterization done the following day, and they put a stent in the LAD. The following day, I had to have the other artery stented, so I had 2 stents put in, and that was a total of 3 stents. Now, my question is, I don't know whether this came from the diabetes or not. And I also want to...
Oh, it looks like we might have lost you there, but I think the second part of that question was related to exercise. It looks like she was also saying that when she exercises, she noticed that her blood sugar goes up. And so I'm thinking that's the second part of the question she wanted to get to.
Okay. Well, first I would like to say thank you for sharing because it really brings, the correlation between diabetes and heart disease together, at the end of our program, and also that heart disease is still under-recognized in women. And so that's the other thing. And we don't know exactly, but we know that diabetes is likely a contributor to the heart disease, yes. Also that the risk factors that diabetes brings about, or that's associated with diabetes, obesity typically, high cholesterol, high blood pressure. There are also cardiovascular risk factors likely present. So yes. As far as blood sugar increasing possibly right after exercise or even within, an hour after exercise, the liver will put blood sugar into the bloodstream during exercise just to give us energy, and that can very well be the reason that the blood sugar can increase right after exercise, and then it will go down. In fact, we need to be careful if we take insulin or other medications like think of glipizide, things like that can lower the blood sugar because we can get some hypoglycemia during or even within a couple of hours after exercise for that reason, because we become a lot more sensitive to the insulin in our bodies. So yes, we can have that increased blood sugar during exercise, but the exercise is very beneficial to the blood sugars. We just see it later.
All right.
Excellent
and one
question.
More time, what is that recommendation for physical activity per week? How many minutes should we be looking to strive to?
Okay, here's our target: 150 minutes. Okay, 150 minutes per week. So that's our target.
That is our target. And as we mentioned, of course, all of this is individualized. And
that's right.
We gave some great information today on our call, but it is all meant for you to take it back to your healthcare team and have those conversations so they can really help to better personalize your care. All right, this wraps up our last question for the session. A few items before we close today. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from you, and we hope that you'll take a few minutes to provide us with your useful feedback. To help feel confident about your ability to manage your diabetes and heart health, we encourage you and your loved ones to talk to your doctor and dietitian about your risks. Go to knowdiabetesbyheart.org to learn more. Register for the next event at diabetes.org/experts. Sign up for diabetes education near you and sign up for ADA's free Living with Type 2 Diabetes program. Links to all of these resources can be found on our registration webpage at diabetes.org/experts. If you have a question about this event or want resources to find diabetes education classes in your area, or if you'd just like to receive an information packet to learn more about living with type 2 diabetes, you are welcome to contact us at askada@diabetes.org, or you can always give us a call at 1-800-DIABETES. Again, that is 1-800-342-2383. Thriving with diabetes takes a village, and we are here to support you. Special thanks to our expert, Dr. Melissa Young, who kept us thoroughly entertained and informed today. I am Shamira Robinson, and on behalf of the ADA team, we want to thank you for joining us today. We look forward to connecting with you at our next Ask the Experts event on March 9th. We will be discussing kidney disease and diabetes. And on April 13th, taking care of your feet. So we look forward to talking with you soon. I'll turn it over to the survey portion to close out our program. Best wishes for good health.
Thank you for joining us today. We appreciate your feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. For participants online, please click on the poll section below the Ask a Question form and click to submit your response. Okay, here's the first question. Number 1, overall, how satisfied were you with today's event? Lifestyle choices to protect your heart. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. So press 1 for not at all satisfied, press 2 for somewhat satisfied, press 3 for neither satisfied nor dissatisfied, press 4 for somewhat satisfied, and press 5 for very satisfied. I will ask that question again. Number 1, overall, how satisfied were you with today's event? Lifestyle choices to protect your heart. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. Press 1 for not at all satisfied. Press 2 for somewhat dissatisfied. Press 3 for neither satisfied nor dissatisfied. Press 4 for somewhat satisfied, and press 5 for very satisfied. While we take a moment for the next question to come up, I'd like to remind you about one of our programs supporting people living with type 2 diabetes. If you haven't recently been diagnosed with diabetes or could benefit from a refresher, consider signing up for ADA's free program, Living with Type 2 Diabetes. Participants receive information via email and e-booklets throughout the year-long program on topics including emotional health, eating healthy, physical fitness, as well as tips on managing and living well with type 2 diabetes. Okay, on to our next question. Question number 2. Which of the following is the recommended target range for your glucose to help reduce your risk for heart disease? Press 1 for 60 to 180 milligrams per deciliter. Press 2 for 60 to 150 milligrams per deciliter. Press 3 for 70 to 180 milligrams per deciliter. And press 4 for 80 to 200 milligrams per deciliter. I'll repeat that question again. Which of the following is the recommended target range for your glucose to help you reduce your risk for heart disease, both before and 2 hours after you eat? Press 1 for 60 to 180 milligrams per deciliter. Press 2 for 60 to 150 milligrams per deciliter. Press 3 for 70 to 180 milligrams per deciliter. And press 4 for 80 to 200 milligrams per deciliter. Before we go on to question 3, we would like to let you know that if you missed a part of today's event or would just like to listen to it again, we now have full recordings available by phone. Call the toll-free number 866-686-8240. That's once again 866-686-8240 to hear the latest recording. And here is question number 3. How much moderate intensity physical activity is recommended per week to see health benefits? Press 1 for at least 30 minutes. Press 2 for at least 60 minutes. Press 3 for at least 90 minutes. Press 4 for at least 150 minutes. And press 5 for none of the above. Once again, question 3. How much moderate intensity physical activity is recommended per week to see health benefits? Press 1 for at least 30 minutes. Press 2 for at least 60 minutes. Press 3 for at least 90 minutes. Press 4 for at least 150 minutes. And press 5 for none of the above. Before we move on to the next question, we would like to remind you again that our next Ask the Expert Q&A event will be on March 9, 2021. Our expert will be talking about diabetes and kidney disease. To register, go to diabetes.org/experts or contact 1-800-DIABETES. That is 1-800-342-2383. Okay, now for question 4. Number 4, as a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, and press 3 for very likely. Once again, question number 4, as a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, and press 3 for very likely. While we await the final question, remember that a diabetes self-management education and support program will focus on your concerns about diabetes. The program will help to empower you with the knowledge and skills to help you manage your diabetes. A link to find an ADA-recognized diabetes education program can be found at the bottom of our Ask the Experts webpage, diabetes.org/experts, or you can speak to a member of our call center at 1-800-DIABETES. That's 1-800-342-2383. Okay, here we are at our last question. Thank you for staying on. Question number 5. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, and press 3 for very likely. Once again, our final question, number 5. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, and press 3 for very likely. Thank you so much for staying with us and providing your feedback on today's event. We offer many thanks to our expert as well as our support vendors and sponsors and No Diabetes by Heart collaboration. This concludes today's program in the Ask the Experts Q&A series. Please check out our website for recordings from this event and additional resources. And lastly, if you have any additional feedback for our team, please stay on the line to leave us a message. Thank you so much for participating in this program.